Hi friends, I'm Dr. Francisca Nisha. Welcome to my channel for the total healing of your body, mind and soul using allopathy, Ayurveda, aromatherapy, naturopathy, therapy and psychiatry. Friends, now I'm going to tell you about peptic ulcer or ulcer of the stomach, its symptoms, causes and allopathic treatment, complete treatment. So do listen to my video till the end to know the treatment if you have seen any of the symptoms which I mentioned. So I start. Excess of acids in the stomach is a major factor that causes sore, eruptions, stomach upset and indigestion or heartburn, and we try to mollify such symptoms by taking antacids which are considered to rectify and prevent sore eruptions. In fact, hydrochloric acid is a natural constituent of our stomach secretions and helps the digestive enzymes to activate. Recurrent bouts of excessive acidity, premature in the form of peptic ulcer, which is a condition of localized destruction of mucosa or stomach or inner wall of the stomach, also called gastric ulcer. When upper part of small intestine gets infected, it gives rise to duodenal ulcer, or we can say that it is a wound inside the stomach or duodenum. Persons who have 6 to 8 times more acid than is normally required do suffer from peptic ulcers, but there are many exemptions or exceptions also. Hence there is also a standard criterion. There are cases which have a low grade acidity, but even then they have peptic ulcers. Now the causes: excessive use of spices, condiments, alcohol, tobacco, coffee, tea, etc. is held to be the basic cause of peptic ulcer. In addition, there are drug induced peptic ulcers which are caused by indiscreet use of aspirin, caffeine, corticosteroids, corticosteroids, indomethane, brufen, aspirin, etc. Symptoms of peptic ulcer are: first, pain in upper part of the abdominal region, usually aggravated by food. Second, pain is sharp, penetrating and of a burning type. Third, in gastric ulcers, pain increases soon after or immediately after taking meals. But in case of duodenal ulcers, pain may occur 2 to 3 hours after taking meals. These are variable timings of occurrence which clearly distinguish pain in other ulcer from forms or one ulcer from the other. The fourth is the type of ulcer can be finally determined by barium meal test, examination of stomach and its contents. The problem gets complicated when there is bleeding or perforation at the site of ulcer, in which case surgery becomes necessary. But in all other conditions or situations, specified drugs and general measures will resolve the problem. Generally, cold and toned milk mollifies the problem, but a bland diet also solves the problem. Milk may be served to be the main thing to be given to the patient even after 15 minutes or even 2 hours, depending on severity, intensity of the case. Milk counteracts acidity and also delays emptying time of stomach, thus allowing the drug to act for much longer period. Now about allopathic treatment for peptic ulcer. First, non-absorbable antacids are preferred due to their delayed absorption. Aluminum hydroxide, brand name Aludrox, is the drug of choice for treatment of peptic ulcer, which might cause constipation, but constipation can be removed by combining magnesium with aluminium. Usual dose is 200 to 600 milligram every hour when there is acute stage, but dosage and frequency may be reduced as the symptoms show a downward trend or starts to show improvement. As complete cure takes much longer time, the medicines should be continued for a month or more, even when symptoms have subsided. In addition, calcium carbonate variations or calcium carbonate variants, magnesium salts are available in Digene gel, Esigon, and Gelusil. The second treatment is ranitidine or Zenitac or Zenitidine or Ranitane block histamine H2 receptors. Dosage is 150 mg twice daily or a single dose of 300 mg at bedtime. In order to prevent reoccurrence of gastric or duodenal ulcers, a 150 mg dose at bedtime would suffice but has to be continued for some time. Third treatment, another drug is cimetidine 800 to 1200 mg to heal an ulcer. Take 400 mg at bedtime to prevent the recurrence of peptic ulcers, but it has been ably replaced by ranitidine, which has lesser, lesser side effects or less side effects. And the fourth treatment is famotidine. Brand names are Femtec, Famotine, Acipin, Fudon, Zentec is 20 times stronger than cimetidine and 7.5 times stronger than ranitidine. Its usual dose is 40 milligrams at bedtime and has hardly much side effects. As for side effects, drugs react and the drug reactions and drug interactions. For all this, read the relevant literature or consult your doctor. These drugs must not be given up suddenly or you must not stop them suddenly unless there is some serious adverse effect. Rather than their dose should be reduced slowly. Once relieved doesn't or it shouldn't mean a total immunity as there could be a reoccurrence at any time. Cimetidine must be used with utmost care as it may decrease the white blood corpuscles, cause sexual dysfunction in males, swelling in the breasts called gynecomastia of females. So do not take any other drug whilst taking cimetidine. Rest of the drugs not mentioned not mentioned should also not be taken without proper medical advice unless dietary habits are systematically followed and are precipitately factor items omitted from diet together, no medicine can show any favorable and salutary results. Self restraint and self management, self discipline, self control are all the well known traits for speeding up a quicker recovery. Omeprazole is reported to provide 100% relief after use of 4 weeks, but in the absence of much clinical evidence, this success rate of this drug cannot be fully relied upon, but other drugs, of course, with requisite safeguards and cautions, may be tried with lesser side effects, even if their success rate ranges from 75 to 85% only. Friends, this is all I could tell you about the peptic ulcer, duodenal ulcer, their causes, the symptoms, and treatment. And if properly taken, it can be a complete total treatment. And first of all, you must remember to change your lifestyle, your habits, as I have mentioned. Only then will you be able to cure this completely and not get it again. And if you continue the same lifestyle or the same habits, then you will get this ulcer or this problem again and again, and then it'll be too much and too dangerous. So once you know your problems or your bad style lifestyle habits, do change them and don't repeat them again and again. Take care, friends. I hope I was able to help you to know all about peptic ulcer, its treatment and the causes and everything. If you liked my information, do like, press the like button and press the bell icon to get future notifications of my new videos. Take care and lots of love to you all. Bye.